Let's talk about injectables.
Okay.
So if you can believe it or not, still today, I hear people say to me, what's the difference between Botox and a filler? Many of them think it's the same. Maybe even a lot of men. And since the male cosmetic procedures are on the rise, can you share with the viewers what the difference is between those two products?
Absolutely, and that's a great question, and I get that same question all the time, whether I'm in a social setting or in my office. And basically, Botox, or really any of the toxins, I should mention that there are 3 toxins now on the market. They're all botulinum toxin A. They all function the same way. Botox is just the first one out there, but Dysport and Xeomin are also available to us, and they all do the same thing, and that is they weaken muscles. And that's any muscle in the body. So I should also say, because most people don't realize, the use of Botox for medical, non-cosmetic uses is way bigger than cosmetic uses. So for people with spastic conditions, like after they've had a stroke or a brain injury or cerebral palsy, those kind of things, the Botox will be used to relax those muscles. So that's the one thing that toxins do. And we use it in cosmetic surgery to weaken the muscles on the face that cause expressions and that causes all the creases that we don't want to see. So really,
I'm trying not to show you right now because
that's
I don't
right.
have Botox.
Oh, you don't have anything. And you know, to your point about men, I do Botox and Xeomin injection. I have them done myself too. So I think you're right. Men are really starting to figure this out. You know,
it's on the rise.
The girls
and they
all
need to
have.
know.
That's right. The girls all have the good ideas, and we discover them and follow suit. So,
but now they're telling their men, so they can get in there and be looking great.
That's
too.
right. So basically, toxins weaken muscles that cause creases. Fillers fill them in. So fillers have no effect on the muscle whatsoever. Fillers are sort of like spackling a crack in a wall. So you've got a crease or a contour deficit that you want to fill, and you'll put in any one of a number of fillers that are available out there. And I use all the fillers because I think some have certain strengths and weaknesses for a particular case.
Now, when injecting your fillers, I know you use something very special and new. Can you share with the viewers the cannula that you use for injecting?
Yes, absolutely. I brought one here. So a cannula is basically sort of a long, skinny tube. And typically cannulas, as opposed to needles, are blunt on the tip. So they don't pierce or penetrate the skin. And as I said, I brought this one here, and I'll show you. I'm actually sticking my finger on that there and wiggling it around, and it's not puncturing my fingertips.
Surprising, it has not shot right off.
Yeah, it's a little bit flexible, and it's the same size. This is a 27 gauge one. They come in different sizes, 25 or 30 gauge. So depending upon the injector's preference, I like to use the 27s though, but they're the same gauge or thickness as a needle.
Okay.
It's just that they don't have the point on the surface, and they're a little bit flexible. So I can actually take this cannula, and if I want to inject anywhere around the orbital rim or the eye socket here where people get hollowing and things like that, I can actually go from a distant location, like here in the cheek, in one single injection port and basically move this thing all along there and do that without having to constantly pierce and penetrate the skin, penetrate blood vessels, and increase bruising and bleeding and pain, and also increase risk of injecting into a blood vessel with a filler that can block it up. So this has been a wonderful addition to my toolbox as an injector. I think it gives me a much better feel for where I am anatomically, what depth I am in the tissues, much better accuracy with how I place the fillers, and much less pain and swelling and bruising for my patients.
So when you use the cannula, do you first have to inject with the different device that's pointed and then the cannula comes off? I'm not sure how that, I remember seeing something a little different.
So
like
what happens there is we'll numb the area up, and depending upon what filler we're using and the patient's tolerance and those kind of things, we may numb a whole area like the whole cheek, or we may just numb a small spot where we're going to insert the cannula. And then at the area where we're going to insert the cannula, we'll take another needle and make just a slight little puncture right in the skin itself. We don't have to go way deep. It's just right through the skin to make a little opening that the cannula then slides through.
So Dr. G, let's talk about the fact that the tip of that cannula is so flexible. How can you put it exactly, precisely where you want that filler to end up?
Well, there is a bit of a learning curve involved with using the cannula. So I think a person, and myself included, when they're first starting out, it can be frustrating. And I would just have to say, you just have to maybe have a few patients, friends or family
Models.
members or your nurse or something like that, that knows that you're learning,
Right.
or take one of the workshops that's out there. I teach in a workshop group that helps instruct people on these advanced injection techniques. So find some people that know that you're just sort of getting the feel down, because it's very much a technique of feel. But once you get that down, I think personally the flexibility of this cannula kind of helps me with knowing how deep I am in the tissues, and it helps keep me safe. Once I'm in a plane where I want to be, I can advance the cannula, and it just gives me a better feel. Whereas with a needle, it pierces anything, and it
Right.
just indiscriminately lacerates the tissues, and so you very quickly can lose track of where you are in the tissue plane.